I think you can see me now. My name's Amanda, and we're going to evaluate some images for the knee. I'm going to set the camera up so that you can see my cursor on the screen. And fade out. Okay, so I have borrowed some images off of Google Images that I will throw away when I'm done. We're looking at an AP knee. To make sure that it's a good image, I need to move my head away from the camera. The femoral tibial joint space should be open. The knee needs to be extended. You want to see that this patella is superimposed over the femur. And you want to see superimposition here of the tibia and fibula. You want to see the intercondylar eminence is centered and that there's no rotation. You can tell there's no rotation in this one because of the superimposition here. Collimation, you want to have it centered. The part which would be the knee, specifically in this image, the left knee. And you want to have a little bit of the femur and a little bit of the tib fib. That's all I can think to say about that one, except for you want to see the bony trabeculation and soft tissues like you do in pretty much every image. So we'll ditch that one for right now. And we'll look at this one. This is the AP oblique projection with medial rotation. You want to see the proximal tibiofibular joint space open here. You want to see just a little bit of the patella to the outside of the medial condyle, epicondyle of the femur. And you want to see both tibial plateaus, open joint space. I might have said that already. I can't think of anything else except for seeing the back of the tibia, or the posterior surface of the tibia. Oh, the lateral condyles should be in profile. I'm not sure if that's how they word it in Merrill's, but it's something like that. And then, of course, the bony trabeculae and soft tissue. Oh, collimation. You want to have the knee joint centered. And you want to be able to see parts of the femur and the tibia and fibula. So we will move on to the medial-lateral projection of the knee. Here we have right knee. And you want to have collimation. You want to have your knee joint centered. You want to see a 20 to 30 degree flexion of the knee. And open femoral joint space. Yeah, but open patella femoral joint space, and femoral tibia joint space also open. And this is open because the central ray was angled, which you can tell because the medial condyle and lateral condyles of the femur are almost superimposed. And there is a adductor tubercle that you can see on the medial condyle so you can tell which one it is. I personally don't see it in this image. I'm used to seeing a little line that kind of goes this way, but I don't see it. So maybe this is it here. That might be it. I'm trying to think. Talked about the superimposition here. Oh, there should be slight superimposition of the tibia and fibula head. I can't think of anything else to say about this one except for soft tissue and trabeculae. This ball is a little 1-inch ball that doctors use to compare joint spaces to the size of the ball. And it seems to me like there's an awful lot of fat pad sign here, but I'm not sure what that would indicate specific to this image. So we'll move on to the next projection, which is an AP axial projection of the intercondylar fossa. In my trigger, I did the Camp Coventry method, which, if I remember from notes from class, makes the whole thing look a lot more elongated than this one, but this is what I found. Couldn't find one without any anatomy on it, so don't look at that. So here we're, again, collimation. You want to have your joint centered in the image. You want to have an open intercondylar fossa here. You do not want to see the patella apex. Actually, you don't want to see it in any of the images that we've talked about so far, except for the lateral because it's in profile on the lateral. But you want to see that intercondylar eminence is centered. This projection is actually looking at the tubercles on the top of the intercondylar eminence for ACL and PCL tears. Those little tubercles will pop off and there'll be little floaters up in here if that has happened. And again, you can tell there's no rotation by the superimposition of the tibia and fibula head. And you want to see the trabeculae and soft tissues. This one you can't really see the soft tissues very well, but the doctor would be able to see the soft tissues in the joint. So we're going to move on to the next picture, which might take me a second to find now. Here we go. This is a tangential projection of the patella, also known as the sunrise view. Here we have a left, and again you're looking for the joint space to be centered in the collimation. The trabeculae of the patella and of the femur. You want to have an open patellofemoral joint here. Trying to remember everything. And the patella always looks like this. And when its superior part is superimposed over the inferior part. You can see a little bit of the inferior apex of the patella down here. So this is a patella in profile. There you go. And that's it. That concludes my image evaluation of the 5 projections on the knee trigger.